Our next presentation is the top cerebrovascular abstract, Stereotactic Radiosurgery for Spetzler-Martin grade 4 and 5 AVMs, an international multicenter study, presented by Dr. Jason Sheehan.
So first, I'd like to thank the scientific board for allowing me to present this multicenter international study. This is a study of stereotactic radiosurgery for Spetzler-Martin grade 4 and 5 arteriovenous malformations. The natural history of high-grade arteriovenous malformations is not well defined. It's likely different than for lower-grade arteriovenous malformations. In fact, we know that these high-grade arteriovenous malformations are difficult to treat. They're difficult to treat in part because of their large AVM volume from a radiosurgical standpoint as well as from a surgical standpoint, also their complex angioarchitecture and their eloquent location. Radiosurgery is a well-established treatment algorithm for low-grade AVMs. These AVMs, in fact, with Spetzler-Martin grade 4 and 5 have clear opportunities for treatment with radiosurgery, with single-session radiosurgery. We looked at outcomes for with regard to obliteration, radiation-induced changes, and favorable outcome, as I'll define. We had a retrospective pooled analysis of 8 Gamma Knife Centers data. We defined favorable outcome as AVM obliteration, no post-SRS hemorrhage within the latency period after radiosurgery, and no permanent radiation-induced changes. This allowed us to define a cohort of 155 patients with a median follow-up of 99 months. The margin dose used to treat these AVMs, high-grade AVMs, was 18 gray in a single fraction. As you can see here, the overall obliteration rate was less than that for for low-grade AVMs. The high-grade AVM obliteration rate was 44% as a whole. The prior AVM embolization and eloquent location pretended a worse outcome in terms of obliteration after single-session radiosurgery. Radiation-induced changes were also higher. 33% of patients had radiation-induced changes, of whom 3.3% were symptomatic, and 11% 3% were permanent radiation-induced changes, and 11% were symptomatic. The factors that portended radiation-induced changes were, in fact, The factors that induced radiation-induced changes were, in fact, age and also prior embolization. Favorable outcome, again defined as obliteration of the AVM, no hemorrhage within the latency period, and no permanent radiation-induced changes occurred in 37% of patients. Again, this is a rather high bar considering the endpoint used in the Aruba trial. However, it's clear that favorable outcomes were affected by prior embolization and the maximum AVM diameter. These factors portended a negative outcome in terms of favorable prognosis for obliteration, no permanent radiation-induced changes, and no latency hemorrhage. So in conclusion, for Spetzler-Martin grade 4 and 5 arteriovenous malformation, single-session radiosurgery affords a very reasonable rate of obliteration and favorable outcomes for a very challenging cerebrovascular entity. There is a higher risk, however, of radiation-induced changes in high-grade AVMs treated with single-session radiosurgery as compared to low-grade AVMs. Prior embolization, unfortunately, lowered the obliteration rates and was statistically associated with radiation-induced changes in this cohort of high-grade AVMs. In our paper, we indicated that, in fact, embolization should be used sparingly only when there are high-grade features that need to be treated before radiosurgery, or when you're trying to reduce the AVM nidus down to a manageable volume for single-session radiosurgery. Volume stage approaches may be a more optimal option for some patients. So I'd like to conclude by acknowledging my contributors and specifically to acknowledge Dr. Stark, who helped with some of the analysis. Thank you.